So come on over here, Eric, you can. This is our Quantum here. This is our Ignite, sorry. This is the Ignite workstation. And when we go to the home page right here, we get different options. And what lights up is usually what is connected. Right now, we have minimally invasive connected, which is here at the front, which is our Quantum. We could plug in an M40 here, and it would show also our Morpheus being connected. Right now, we've done the Morpheus on her upper abdominal area. Now we're going to do the Quantum. Typically, we do the Quantum first, followed by the Morpheus. It really doesn't matter what order you do it in. Now, once you do the Quantum, it kind of hurts to get the Morpheus in there that deep. So you're going to need local anesthesia. And so I promised I'd talk about that a bit. You got to be a localist in your medical spa in the side office sometimes. For fractional carbon dioxide, for Quantum, just using nitrous oxide alone is not enough. So we give our patients some nitrous oxide. At the time, we do some regional anesthesia. So I'll put on my gloves here. And we do a sterile technique in a clean environment. Right now, we've kind of overdone it. Typically, all you need is square drape the area you're treating like you're doing a lipoma or removing a mole in your side office. And you've got to make it anesthetic like you're cutting off a mole or a basal cell or a lipoma. And so we've identified, zoom in here, Eric, if you can. We've identified her upper abdomen as an area we want to treat. Okay? That's the area we want to treat. Now, we were able to use inhalational nitrous oxide and topical with the M40. We did the M40 at 7 fix, 6 fix, and a burst. Now, I would say even that's uncomfortable. And so you want to get good at a regional technique, and this is a very simple regional technique. This is using mesotherapy lidocaine. And this is the mesoram tip. You can get linear 5, linear 3, circular 6, circular 9. I like the linear 5 on all body areas. You can also use the 3, and we'll see that later, when you're doing face areas, like around the eye and around the mouth. This is a simple technique. Now, what about the lidocaine? What do we use? Well, typically, I'll put one bottle of 1% width, so 20 mils of 1% lidocaine, in 500 or 1 liter of saline. And typically 60 to 80 cc's per area. So the risk of lidocaine toxicity, very low. But know the difference between a vasovagal response, eyes roll back, sticky, little sweaty, bradycardic, versus a true lidocaine reaction. Typically they get a little tremulous, a little agitated, there's a metallic taste, and you've just put in too much lidocaine. And your staff should be trained no matter what. All of these techniques, Botox, filler, laser, anytime you use lidocaine, trained on ACLS and basic life support systems. So if we could not videotape our patient here today on your cell phone, I don't care, but she hasn't consented to be on your cell phone. I got in trouble once, and it took about a year to mitigate this trouble because she showed up all over the internet, which I hadn't warned her about. So there's lots of great video on the Boomerang Learn site. If you own a system, you get access to that. So you've got the inhalational, just give her a little inhalational. So some deep breaths. 50% nitrous oxide, nice, slow, deep breath. I'm going to inject this little bit of lidocaine. These are only 4 millimeter, 31 gauge, but it goes down about 1 centimeter or 2. Now that's good for the Morpheus, but not good enough for the Quantum, because we're going to treat 1 centimeter, 2 centimeters with the Quantum. And so usually I start with this technique, and we go about every centimeter, and we use about 30 cc's superficially, very quick little mesotherapy lidocaine technique. And if you're using very assertive Morpheus, this is all you need. If you're doing line management in the face, you don't need craniofacial blocks. You can do them, but you always need to top up, in my opinion, with a little field block with that technique. Now, once you're good for Morpheus, because that goes down about 2 centimeters, the M40 goes to 7 millimeters, we need to top that up with the same diluted lidocaine, but now I'll use a 25 or a 22 spinal, and we'll lift this up and beyond. Of course, you always feel in the umbilical region. Make sure there is no herniation. Make sure they haven't had a laparotomy. If you're uncertain if there's a hernia, do an ultrasound. We don't want to be treating the bowel. okay? Now, once your inner thigh, outer thigh, submentum, jawline, you stay subcutaneous, you're safe. But on the abdomen, just be cautious. Lift up, and now we're going to top it up with just a little infiltration, advance and jet on the way back. And I'm treating down to about 3 or 4 centimeters. I'm lifting up and away from the rectus abdominis. I'm doing a simple little lidocaine infiltration, nowhere near the toxic dose. Make sure you know what that is. And I'm using very, 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 very dilute lidocaine. And this lifts and separates the fat. It lifts the fat up and away from the underlying rectus sheath or in the arm, the tricep, inner thigh, the gracilis, outer thigh, vastus lateralis, submentum, the platysma, jowl and jawline, the SMAS. So up and away from the muscle. Now, I've got a safe subcutaneous envelope that I can go deeper than my M40. What am I going to use? I'm going to use my deep Morpheus effect of this quantum RF10. Let's zoom in on that, Eric, if you can. Give me a little close up on that.